So we can categorize varicose vein procedures into thermal and non-thermal. Last 20 years, what's called the endovenous revolution occurred, which basically means that procedures went from the hospital to the office because of catheter-based technologies. So as far as the catheter-based technologies go, we can either deliver heat to the vein to close it. The newer technologies, we can use non-thermal or devices that don't use heat. The thermal ablation came out first. Radiofrequency was approved in 1999 and laser in 2002. Basically, it's a catheter that goes in the saphenous vein. We surround the vein with local anesthesia and cauterize it with heat. Radiofrequency and laser have been around. It's proven. There's much clinical data out there showing good success, and in general, it's already well into our medical system as far as an accepted therapy. The newer technologies are called non-thermal, one of which is cyanoacrylate glue, the other is a polydocanol foam called Varithena, and the third one is MOCA, or mechanical chemical ablation, also called Clarivane. These all have been around a few years. They've recently gained FDA approval. However, insurance companies have not widely adopted this, and it's still considered experimental by some companies. The idea is that we don't have to place local anesthesia around the saphenous vein, so the patient gets saved a couple needle pricks. In my practice, I prefer thermal ablation because people with bulging veins want to see them removed, or they don't want to see them when they leave the office. So we do a combined procedure of a thermal ablation, which is either radiofrequency or laser of the saphenous, and then remove the bumpy veins at the same setting with something called phlebectomy, which means we remove the veins through small needle holes using a tiny hook. There's no sutures involved. So that's that in summary. There's thermal ablation to close the saphenous, which requires local anesthesia, and non-thermal devices which don't require local anesthesia. It's not a lot of long-term clinical data on the new non-thermal devices, so we'll see how these play out in the future.